music to the noise, yeah, the mess we make. Machine Pun Kelly get caught in the fray. Facts and logic with a twist of chest. Strip it down to truth, yeah, forget the rest. You propose the lies right out of the park. Look beyond the shadows that set the dark. Sparks of laughter fire up the night, bringing clarity when they blur the fight. Cut through the chaos, yeah, the tangled lies. Steve Pun Kelly with a set of clear eyes. Truths and jokes gonna rock this show. Step into light where the real facts glow.
Hello and welcome to the Punch Show. Today I'm joined with my brother from another mother, Steve Schwab, and he is a PhD in economics from Wharton. He is the former CFO of BAMC, and so he actually knows what he's talking about when it comes to economics and hospitals especially, and with all the stuff that's going on right now with the ACA and the Medicaid cuts, and even how that's kind of like one of the drivers, the main driver in the shutdown. I thought it would be great to have him on to discuss all of this and what it all means. So welcome to the show, Steve. How you doing today?
Hey, great. And just in case anyone's not familiar, BAMC is Brooke Army Medical Center. It's the DoD's largest hospital, where I was CFO. But doing great. Good to be here. Thanks for having me, Kelly.
So can you, based on your understanding, explain what is going on with, like, what is the issue with the ACA premiums? You are supplemented premiums. What are they called again? The enhanced premiums, right? Or
yeah, it's the enhanced premiums. Yeah. So, yeah, just before we get into that, can I just introduce myself a little bit, because I am running for office and I want to make sure listeners know who I am. And so, as you mentioned, Kelly and I are half brothers. And so we call each other brothers, but we have different mothers. But I am running to represent House District 44 in the Texas legislature. I am a retired Army officer. I served 21 years, spent about a decade doing field medicine. If you've ever seen MASH, think about the people that brought the wounded to the MASH. And that was sort of what I did. We would stabilize and get injured soldiers to the next level of care to the best of our ability. After that, I was sent to get my MBA and a Master of Health Administration through Baylor University. Ended up serving as the CFO of DoD's largest biomedical research institute. While I was there, I got offered to go to get my PhD, applied and got into Wharton, did a PhD in applied economics with a focus in healthcare at Wharton. And then later on served as the chief financial officer, as I mentioned, of Brooke Army Medical Center, the largest hospital, retired and became a professor at the business school at UT San Antonio. Quick disclaimer, neither the military nor UT San Antonio as public organizations endorse. This is just my bio. And so given everything going on in the world, I decided that I wanted to try to make a difference politically and decided to run for office. But I do have a lot of background in healthcare. I've been serving, working in it for 25 years. So to answer your question now on the enhanced subsidies, basically I'm running for the Texas state legislature. One of the reasons, there are many, but healthcare is a major issue. So in Texas, there are a couple of very large healthcare issues. One being that Texas is a non-Medicaid expansion state. We have the nation's largest number of uninsured, which is a combination of the fact that we have a lot of people, but also we have a lot of public policy failures for those people. Despite being, if Texas was its own country, we'd be. What's that?
The uninsured rate in Texas is like 20%. Like the uninsured rate is also the highest in the country.
Yeah, it's not quite that high, but it's very high. It's somewhere, I want to say around 15% off the top of my head. And so it is extremely high uninsured rate. And again, this combination of public policy failures, despite the fact that if Texas were its own country, its GDP would be the world's 8th largest, right? And so it's a bigger economy than, say, Italy. And so you're talking about a very prosperous state, yet we have the nation's largest both proportion and number of uninsured individuals. And then and then we have a ton of rural hospitals closing. We also lead the nation in rural hospital closures. So all of this creates a real healthcare storm that's approaching our people. And then we have some other issues with education, with infrastructure that, if you want to, we can get into, that really led me to run. But to just sort of set the table for what is going on with the ACA, what the enhanced subsidies are, and why the government shut down right now, I want to bring you back to when the ACA was passed under, in the first year of the Obama administration. And so they realized, they being Obama and his advisors who wrote the law, that healthcare insurance is largely unaffordable for those that do not have employer-based healthcare and are not eligible for Medicare or Medicaid. And so what they did was they designed a system where there would be a private exchange, that somebody who either their employer didn't offer health insurance, or they had their job, or whatever reason, if they were not eligible for Medicaid, they could come in and buy health insurance on their own. At the same time, there was this idea that Medicaid would be expanded. And for people that were in the working poor, they would be eligible for Medicaid, even if they didn't meet sort of the very, very strict criteria some states have put on it. And the federal government would largely offset the cost of this program with some state funding, but mostly federal government.
And wasn't part of
the expectation was that all states would expand Medicaid. Supreme Court ruling said.
Sorry, I think there's like some kind of lag going on, but wasn't there also like part of the whole thing was that by creating this marketplace, that there would be like risk pooling going on, like you get with employer-based insurance, so it's not as like extreme in terms of if somebody's a higher risk.
Yeah, there is. Let me.
Did I lose you, Steve?
Yeah, there is that to some extent. I'm apologies. Okay. See if this works better. So there is that. Let's hold that for a second, because that's kind of a different issue than what's going on with the subsidies. And so the first thing was that when you buy insurance through your employer, the employer pays somewhere 60 to 70% of that premium. When you go and buy insurance in the exchange, you are paying 100% of the premium. Kelly, did I lose you there?
I think something's choppy with your internet. Are you hardwired in or on your wire on Wi-Fi?
Okay, I am hardwired in, but let me, if it's okay, can I switch to my phone?
Yeah.
I don't know if you could hear me, but I'm gonna go ahead and switch to my phone, so we can continue the conversation without the issues.
Oh, wait, I remember. You have the cheapy computer you bought.
I do, because I can't use my government computer for political work, and so I had to buy another computer. But I hardwired in, but still not working. I'm switching to my phone, and so we shouldn't
Okay.
have this issue.
All right. So, are you just going
So
to go
I
to the
apologize to the listeners who are on.
Okay. Okay, there we go.
Okay. All right. So hopefully this is better. Okay. So I know we got a little bit choppy. I'm going to put aside the issue of risk pooling for a second. It is a major issue with the exchanges, but there's a number of issues to go through to understand what's going on right now. And so I want
Okay.
to start with the subsidies. And so when you buy employer sponsored health insurance, the employer is generally going to spend 60 to 70% of the premium, and they're going to get a tax rebate for doing it. And in the long run, that is coming out of workers' wages. But let's just put that aside for a second. Just understand that out of pocket, people with employer sponsored health insurance are paying for about a third of the cost of the actual plan. When you go on an exchange and buy health insurance, you are paying 100% of the cost of that plan if there are no subsidies. And so when they wrote this law, what they worked in was if you are between 100% of the federal poverty level, if you're basically at the poverty level, to 400% of the federal poverty level, so 4 times whatever that is, depending on your family size, there would be some level of subsidy to keep you from having to pay as much out of pocket, because it would be completely unaffordable for you to pay for the whole thing at that level of income. And it was, as you made more money, it was a little bit less subsidies. It was all indexed to the second lowest silver plan, which is sort of this like mid-tier way of doing it. And there's a lot of math and optimization that goes into deciding how that was done. But at the end of the day, the government is helping offset the cost because you're not getting an employer to offset the cost when you're buying through the exchange. Now, hold on one second, Kelly. I'm not getting any sound.
That was my fault. I was on mute.
Okay.
So it was kind of like a compromise between government paid health insurance and private paid health insurance, to where it's kind of just offset the cost for people that couldn't afford it, and it was to reduce the number of people that were uninsured.
Yeah, exactly. Right. And so now this created some issues. So one, if you look even today, if you look and look at the actual plans that you're buying on the exchanges, they tend to be more expensive than you would through a group. And part of that is because risk pooling, which we'll get to in a second. They tend to have much higher deductibles. They're still not as affordable as you would want for this, and there's a number of reasons and changes in the law that have caused that. I'll get to that in a moment, but I want to talk about what the enhanced subsidies are. And so during COVID, the government said, hey, look, if you make 401% of the federal poverty level, you are getting no subsidy, and yet the cost of healthcare is still really expensive. And so what they built in was basically a stopgap that said, regardless of your income level, you never have to pay more than 8.5% of your income in premiums for your health plan. And said, and this way you don't have this sharp cutoff at 400%, where at 399% of federal poverty level, you get a subsidy, and at 401%, you get zero.
Mm-hmm.
That was a temporary measure. It was passed for, I believe it was 2 years initially, and then it was extended for a year. That expires at the end of 2025. And so the big argument is whether or not those enhanced subsidies should remain in place. There is a lot of good reason to say that those enhanced subsidies should remain in place, because you don't necessarily want, from an economic standpoint, it's not good to have this big cutoff at 400%. And again, we're talking about insurance itself is just expensive in this country. And I'll talk about why the ACA did not cause that issue, despite Republican talking points. But insurance is expensive, and if you're paying the full weight of it, both the employer and the employee, then you are really, you're talking about, depending on the insurance, you could be talking about, for a family of 4, like $25,000 a year, right? $27,000 a year, somewhere in there. where somebody who's got employer base won't pay, is going to pay a third of that, maybe $8,000 or $9,000 a year. Still not cheap, not making that claim, but certainly nowhere near what we're asking them to pay. And so by having this 8.5% max, you say, okay, that makes sense. The Republicans aren't completely wrong. There is an argument to say, like, if you're making more than 400% of the federal poverty level, do you really need the government to subsidize this? There's no upper limit. So, if you're a millionaire, you can't pay more than 8.5%. Now, again, I don't think that's really realistic, simply because it's all still tied to this mid-tier, second lowest cost silver plan on the exchanges. And so the millionaire just wouldn't get any subsidies based on the way it's designed. But I think there's an argument to be made about at what levels should the government be involved, and at what point does it not make sense to be subsidized. But again, you're talking about people who are in a different risk pool, and again, we'll get that in a second, paying the full weight. And so having some government subsidies does make sense, or people just won't be able to afford health insurance.
But Steve, what is the federal poverty level?
It depends on the size of the household. I'd have to look at it. I want to say for a family of four, it's somewhere around $30,000.
So that would be like $120,000 a year would be 4 times the.
Yeah, exactly. Right. So, yeah. And again, the subsidy level at that level is not very much. It's one of those things where you can pay up to 8.5%. So at exactly 400%, if it's 120, they can pay somewhere around whatever 8.5% of that is, probably around like $9,500, somewhere in there. Insurance for a family of four is like $27,000. So there's definitely a subsidy coming in at exactly 400%, but it's going to tail off as people make more and more money. The second thing has to do with risk pooling. People who have employer-sponsored health insurance tend to be healthier on average, right? It's not random who has employer-sponsored health insurance. They tend to be wealthier people. They tend to, come from, different sort of socioeconomic status. They had access to better nutrition. They have access to maybe cleaner air where they live. And so these are generally going to be healthier people, which means the cost of insurance, because they're in the same, what they call a risk pool, all these people are sort of putting their money together to pay for all of their care, is going to be cheaper than people who are in exchange, who tend to be a little bit poorer, maybe not have as much of a support system, maybe not have as good nutrition, all these things that apply. Maybe they live in urban areas where they don't have as clean air. All of these things add to it to say these people are going to be riskier, and they're only being pooled really based on their geography, not based on who they work for or any other type of subset, which is going to drive up the cost to begin with. And so the plans are going to be more expensive on an exchange than they are in the employer-sponsored group market, just by the nature of how it works, and how you're pooling that risk. So that's one reason. If you go on the exchange, it's going to be more expensive. The second thing is, a lot of, when this was first passed, there was temporarily what we call reinsurance. And so reinsurance says, hey, look, if you're an insurer and you get the bad luck of having the patient with all kinds of rare diseases that costs whatever, $10 million in care, you can have insurance on the insurer, right? And so they're only going to pay some level, maybe up to $1 million, and then somebody else, right? The government is going to take on that risk. When the ACA was implemented, that was done for a couple of years. I think it expired in 2016. Some states have implemented their own reinsurance. Most states have not, including Texas, which does not have a reinsurance. That means you're putting all of the risk on the insurer. And so they can lose their pants, right, if they get some bad outcomes among their patients. This is going to very, very much discourage smaller insurers from being entered the marketplace. And what's going to lead to is integration and market power among insurers. And you get something like we get today, where you really have 3 dominant insurers in the country controlling the market.
Sounds like just about everything else
Yeah, it is, right? And we know that competition increases, right? It reduces costs for employees, or it costs for patients. Generally speaking, right? I'm an economist. I'm a capitalist. I believe competition is good.
Mhm.
Now, there's a limit when it comes to insurance. You have to have a big enough pool to be able to offset the risks. If you have reinsurance, that helps you offset the risks through another way of doing it. And so government coming in as reinsurance makes a lot of sense. Um, but most states don't have that. Again, there are maybe 15 that have reinsurance rates
So I'm just
processes.
thinking here as you're
Mhm.
talking that the sicker you are, the more expensive your insurance is going to be, and the less money you're probably going to be able to make on average. So
Ding,
there's
ding,
kind of
ding,
like
ding, ding.
this,
Yep.
like,
Well, and this is part of the problem with the exchanges, and where we need to adapt what's going on in the exchanges, because the average deductible on an exchange policy is like $10,000. Around, I'm sorry, out of pocket max is $10,000. Most people don't have $10,000, especially people who are buying their
mhm,
care through the exchanges, don't have $10,000 lying around. So they have to avoid care even if they have insurance. And the deductible is somewhere around $5,000. Again, when you're talking about people who maybe are at 130% of the federal poverty level, $5,000 is going to bankrupt them, right? They don't have that kind of cash sitting around because a lot of these are the working poor.
mhm.
Um, and this is part of the challenge, is that when this, it was designed to have everybody
Because
up to,
they're obviously at least within 400% of the poverty level already. If you're
well,
over
I mean,
400%, you're not on those exchanges.
well, not necessarily. You can be on the exchanges with over
Oh,
400%. You're just
but
not
you're
getting a
not
subsidy.
getting
Yeah,
supplement.
yeah,
Okay.
yeah, exactly. And so there are people on the exchanges because they're self-employed or some other reason that they don't have employer-sponsored health insurance. But keep in mind, right? Like entrepreneurship, small businesses are the backbone of our country, right? They fuel our
Mhm.
economic growth. If you are self-employed, you are paying both the employer and the employee version of Social Security, FICA, right? All those like employer taxes you're paying, and now you're paying the full weight of your health insurance. And so it becomes very, very economically difficult to have your own business unless you're married to somebody who has employer sponsored health insurance or
Mhm.
some other way of getting it. And so we're really discouraging the things that we know are economically good for our country. Um, Now, I'm not going to like sit here and say that there are easy answers. There are not easy answers to this. Health insurance is expensive. Now, next question, or the next logical question, I think, is okay, well, why is health insurance so expensive? Right? Why is a family of four paying something like $27,000? Again, including the employer contribution, but that's still all going to the insurer for a health plan. And I think probably most of your viewers would say it's the health insurers, right? Why are they charging so much money? And I want to make people aware, because this is one of those things I find many people are not aware, that insurance, to my knowledge, is the only industry in this country that is capped in what they can make for a profit.
Mm.
And so a health insurance depends on whether you're an employer or in the exchanges, but generally between 80 and 85% of premiums have to be spent on healthcare costs. That doesn't include the administrative overhead. That is just either paying for direct medical care or what they call quality improvement, things to improve the quality of healthcare. That means that they can make a maximum in general of 15% before administrative costs. Administrative costs are generally somewhere around 7 or 8%, which means their maximum margins are really somewhere around 8%, what they can actually make in profit. Now, when you have really big companies making, with big numbers, 8% of a really big number is still a really big number. And so nobody is asking you, or I'm certainly not asking you to feel sorry for the insurers. But it does, again, lead to reduction in who's willing to get in, right? A small insurer is going to have a really hard time when they're already maxed out on what they can make in
Right.
profit. And here's the real thing. Insurers typically make their money through a combination of things, right? One is negotiating with hospitals to keep prices down. Well, if you know that you have to spend a certain amount on medical care, your incentive to negotiate and keep those prices down is lessened, right? And I'm
Mhm.
not saying that they're not trying, but there it's very much lessened to keep those prices
15%
down.
of 100 is $15. 15% of 200 is $30.
Yeah,
So you
exactly,
make
right?
more money the more expensive the healthcare is.
Yeah, yeah, exactly, right? And so and this is not something that comes up a lot, and I have real concerns with the way they call them medical loss ratios are used in the industry. Now, the one of the reasons these exist is because the other way that insurers can keep these down is just by denying care, right? And we know, especially if you go back to like the late 90s, this was
Mhm.
sort of the MO of insurers was just deny, deny, deny.
They made
And
what's the
this,
movie? The Denzel Washington movie, John Q or something?
oh yeah,
Yeah. It
right.
was
And
basically
there's
inspired by that whole kind of thing.
It is, and you can see like if viewers want to Google it, look at like "Funeral at an HMO" is an old Michael Myers episode from the '90s. Um, you know, again, you can these things are politically have a political bent, and so there's arguments on both sides. You certainly want an insurer that is holding the hospitals and the doctors accountable. And as
Mhm.
much as people like to think that their doctors are completely altruistic, there's been lots of instances of people having care that's really not needed because it pays money. And so
Mhm.
it's a balancing act. There's tons of room to improve the system. And I think, I don't know, there's a quote that I could say from President Obama, but I would firmly believe that he intended this as a starting point, not as a finishing point, right? And if you
Yeah.
look at Medicare passed in the 60s, right? When implementation is 67, I believe, has been, revised and revised and revised umpteen times since it went into place to make it a better product.
Mhm.
Is it perfect? Absolutely not. Is it a reasonably good product at this point in time? Yes. And I think the same thing with the ACA, where it is not a perfect product. Again, asking people to spend this money for a $5,000 deductible and $10,000 out of pocket max, for many people, that's as if they don't have insurance.
Mhm.
And some of that is because of laws that were implemented by Republicans and or that created additional risk um, for the insurers. Part of it is bipartisan laws that have been passed that you know you can argue it's because of who's donating money and lobbying that just don't make sense for keeping prices down.
What about
Um,
people that say the Republicans have passed legislation to sabotage the ACA? Like getting
100%
like
true.
the $0 the $0 fine if you don't have any insurance for some, for instance.
That's yeah. So they have definitely. There's definitely ones I can look to. Though you're talking about, so they couldn't get rid of the individual mandate and said you had to buy
Yeah.
insurance. So what they did was they changed the fine to $0. The actual economic research in this showed this that the fine was never big enough to actually get people to buy insurance, right,
It was
on the
like
margin.
$50 or something. Like it was insane.
Yeah, it was so much less than the actual cost of insurance that it was never well implemented. And in fact, there's research by one of the architects of the ACA that shows that if you wanted to have it actually work, you have to have that fine be somewhere around 25% of the cost of a policy before it's really going to change enough human behavior in order. So the individual mandate, sure, like I think it was probably a good idea in general, but it was never implemented in a way that was actually going to get people to buy insurance. And I'm not super worried about that. I don't think it had much effect when they set that to 0. I'm much more concerned with the fact that when they implemented the ACA, they had what's called risk corridors. And the idea behind a risk corridor was you're asking an insurer to enter a market that nobody's ever been in before. There was a ton of uncertainty that said, okay, well, how much should I charge in premiums? How much am I going to pay out? They had almost no data to go off of on this. And so part of the law said, okay, you know what? If you have these excessive losses, the government's going to help come in and
Mm.
stabilize. And if you make way more money than we thought, we're going to use some of that to offset. Now, the cost of stabilizing was going to be more than what they could bring in from those who did particularly well. And there was risk adjustment. There was a number of there were 2 other programs to do this, but the risk corridors were really the one that was set to say, hey, this is temporary. We just need to stabilize the market as people are getting into
figure out what it's actually going to cost, and so you can know what price.
Exactly. Marco Rubio, sort of led the initiative to say this is a bailout of insurers, which is really BS to say the least. It was, it was designed to get more insurers to enter the market because it was too risky. So 2 things that are sort of really bad on this is, one, they remove these risk corridors. And so you got a lot of insurers pulling out of the market because of this uncertainty. Second is the insurers who were in then sued the government. It went all the way to the Supreme Court, and they ended up having to pay them anyway. So we disrupted the market and didn't actually save any money for the government. And so it's one of those things where, it's political candy. People who don't understand what's going on say, why should we be bailing out big business? And I'm not against that. We shouldn't be bailing out big business, but you have to understand that if you don't have the structure in place, people aren't going to enter a business, right? We have to create a safety net, or the uncertainty is sort of the enemy of business, right? It's one of the reasons that you've seen the stock market go down, go up, go down, go up with these tariffs. People, and we can get into another day or another time, sort of how bad tariffs are. But in general, businesses that
Steve is not a fan of tariffs. I'll just let you guys know that.
Yeah, very much. I'm a free market, right, fan of free markets. Now, not unfettered free markets. Sometimes you need government intervention, just like here. But in general, tariffs are just bad policy. But beyond that, right? If companies know what the future is going to look like, at least broadly speaking, they can plan for it and they can work around it. But big business hates uncertainty, right? And so having a real uncertain market, we don't know who's going to join, we don't know who's going to buy, we don't know what their costs are going to be. That is really discouraging to our business, and most businesses are just not willing to take on that risk, especially when there's no real reward to it. Because if they did really well, they're not going to be able to keep the savings because of these medical loss ratios where we've barred how much they can make, and yet their losses are not barred, right?
So that's what I was about to say, risk reward. If there's greater risk than there is opportunity for reward, businesses and insurance companies just aren't going to go in that direction because it's bad business to do that.
Yeah, exactly, right? It's like going to a blackjack table and saying, okay, minimum bet's $100, but if you win, we're only going to pay you $10, right? Who's going to put that? I can lose 100 but only make 10 on a 50, whatever bet. Just doesn't make any sense. And so what we saw was the only insurers really who stayed in the game are the really, really massive ones that don't have as much risk. And so you got a lot of counties that only had 1 or 2 insurers, really no competition. And so what happens when you don't have competition? Well, prices go up. And so, generally speaking, again, we want competition, but you've got to put the parameters on it in order to create that competition. And so right now, subsidies are generally going to help, but there's a lot of other things we need to be doing to be stabilizing these markets and allowing smaller insurers in. Now, when I say smaller insurers, those insurers still need to meet some basic criteria. And this is where people sometimes want to go and say, oh, well, pre-ACA. Well, pre-ACA, if you got sick, you could lose your insurance. Or you could have insurance that just wouldn't cover you, right? So one of the things about the ACA is they said you can't discriminate based on somebody's, say, health status or their gender.
I just want to mention one thing about, when I was, I don't know, around early 30s, I don't remember exactly how old I was. I was depressed for 2 months, and I was on antidepressants for 2 months. And for years, up until the ACA, I could not get insurance without a massive hike on it. I was self-employed, and so I couldn't get private insurance at all from most companies. And the ones that would, I had to pay super jacked up prices because I had been on antidepressants 5 years ago for 2 months. It's when people think of pre-existing conditions, they might be thinking you've got these really serious conditions. But, pre-existing conditions could be anything like diabetes, high blood pressure, a history of pregnancy.
I was gonna say even
insane.
pregnancy, right? They could discriminate because they didn't want a pregnant woman or somebody who was likely to become pregnant because that was a cost. And the ACA stopped all of that. That doesn't mean, again, that does not mean it's perfect, because when you stop that and say, okay, we have what's called guaranteed issue. Guaranteed issue means that if you want a health plan, they have to offer it to you. And we also have something called community rating, which says you can adjust the price based on a few demographic things. So you can adjust based on someone's age, the zip code they live in, and their smoking status. But your highest premium can't be more than 3 times your lowest premium. So there are these specific guardrails. Now,
so
what that means,
I want to absorb that for a second. Your
Yeah.
highest premium can't be more than 3 times your lowest premium. That means companies were doing more than that before.
yes,
Like it
right?
wasn't just like a slight hike or like 20% or something.
No, it was, so they had what's called medical underwriting. And so they would look at all of your history, just like you with depression, or somebody who's likely to get pregnant, or
They'd have like a nurse. They had a nurse come out to our house and interview us both. Like,
yeah. And then they would say, you know what? We think you are likely to cost us, let's say, $50,000 in the next year. So we'll issue insurance, but it's going to cost you $50,000, right?
Yeah.
Which is not having insurance at the end of the day.
Yeah.
And so there were no limits on this. Or, hey, we'll give you insurance, but we're only going to cover X, Y, and Z. All of that went away. Now, to some extent, that did raise average premiums. And so if you were healthy in the old days, you might pay a very low premium because your expected losses were very low. The community rating and guaranteed issue means that everybody sort of needs to put into the pool. And so for those that were particularly healthy, their prices were going to go up. At some point, somebody has to pay for it, right? The money has to come from somewhere. And so option A, those who are sick just don't have insurance, and they either need charity care or don't get care. Now, the average prices are low because they're not insured, right? If you're uninsured, your premium is 0, right?
Right.
Option B, everybody has access to insurance, but the average price is going to be based on the average costs, right? And so we've chosen as a society, when we passed the ACA, and there's certainly arguments to be made about society versus who controlled the legislature at the time. But the choice was made that we would rather have higher average costs, with the government coming in and helping subsidize those on the lower end of the spectrum. And oh, by the way, an individual mandate that comes in. Now, I'm not a huge fan of the individual mandate. I would rather just subsidize the healthier people through the government. And rather than say you have to buy this. But regardless, right, we can do a tax and says, hey, look, if you don't have insurance, we're going to charge you this tax, which is what the Supreme Court found the individual mandate was. But the money has to come from somewhere.
Right.
No doubt the money has to come from somewhere. And so, sometimes I feel like even on my party, the talking point is almost like, oh no, it's, it's free chicken, but it's not, right? The money has to come from somewhere. Certainly, on an average part, it hurt. But the alternative was people just don't get care. And, there's this broader piece that if you're not getting the preventive care or the initial care when things are low acuity, then what happens? You get sicker and sicker and the costs go up and up. And so overall, over time, it could potentially reduce the overall costs and the average costs, but that's not something that happens over the course of a single decade, right? That's a long term. We are investing in primary care, and we're investing in getting people care they need when they're in their 20s and 30s, so that they're not as sick when they're in their 50s and 60s. That's a long-term solution. It's a viable solution, and it makes a ton of sense economically and medically, but it's not something you're going to see in a few years of having the ACA. And there's been enough challenges with it that I don't think we're seeing it quite yet.
What about people that say that, they don't care it doesn't affect them. They have employer-based insurance. ACA doesn't affect them at all. Is that true?
Well, first of all, I want to be clear. The ACA affects everybody, not the exchanges. The exchanges are one piece of the ACA. The ACA is way broader than just the exchanges, right? It stops discrimination. It allows kids to stay on their parents' insurance until they're 26, right? It keeps people from being denied insurance because they're sick, which could still happen in the employer market before. Um, uh, Number of provisions that change the way we regulate healthcare in this country were part of the ACA. And so it's not, it does affect everybody. The exchanges themselves do impact people in the employer market, but in a much, much more circuitous way. And so I'd say something like, what happens if you lose your job? Right? Where do you go for care?
Mm.
Because just because you have employer-based insurance doesn't mean you'll always. What if you want to retire early? What if you're 55 and you have a nice little nest egg, but paying for insurance is really expensive? Now, should government be subsidizing somebody to retire at 55 rather than 65? There's a fair argument to say no, those aren't people that should necessarily have government subsidies for it. But they should still have a reasonable place where they can buy insurance.
Mhm.
And then obviously the level of competition in the market. There are few insurers that are only in the employer versus the exchange. Most
Mm.
are sort of across the spectrum. And so you can imagine that, it is impacting what you're doing between the marketplace and the employer sponsored, but it's much less direct, right? They're different risk pools. And so the premiums that need to be charged to offset the risk are very different between the two. And so you really do have to think about them separately. But just keep in mind, the
One thing
ACA is a much broader law.
like what my impression is, and you can correct me if I'm wrong,
Yeah.
that just because you don't have health insurance doesn't mean you never get health care. Like you
Oh,
have
absolutely not. Yeah.
you have emergency health care. For instance, somebody can't afford blood pressure medicine, so they end up having a stroke, and so they go to the hospital and they get taken care of. They don't have the money to pay for that, so the hospital then passes on the cost of that to the paid insurers or to the people that have insurance. And then if that's through employee insurance, then that can connect to maybe you're not getting paid as much, or maybe you're not getting the same Christmas bonus. Like all the cost ends up getting passed on to the insurance payers, one or the people who pay for insurance one way or another. That the cost has to be offset somehow.
Yeah, it does, right? So first of all, there's a law called EMTALA. And what EMTALA does is it says if you show up in an ED, they have to stabilize you before they can even ask you if you have insurance, right? So they start by triaging, making sure you're okay. If you go in with a stroke, they're going to treat you. They don't have a choice. Anyone that takes federal money, say Medicare, has to do this, is subject to this law. So
And this was
everybody
Reagan
has.
passed this, right?
Yes, this was under Reagan, right? That every hospital that takes Medicare or Medicaid has to stabilize before they can start talking. Now they can stabilize and release, so it's not great care, but it's something, right? So
And they passed that because people were like literally just being
yeah,
left to die outside the hospital.
totally, right? Completely. And so there was really good reason with why this was passed. And so everybody has a baseline. Now, hospitals keep track of what they call charitable care or uncompensated care, as well as bad debt, right? So bad debt is we sent you a bill, but you didn't pay it. Charitable care is like we knew that you were never going to pay it, and we just accepted that. Not-for-profit hospitals, they get their not-for-profit status based on doing a fair amount of this, right? Of this charity care. Now, keep in mind, a not-for-profit status is a huge subsidy to the hospital, right? They're not paying taxes on however much money, right? Whatever their revenue is, they're not paying taxes on it.
So they're not necessarily not making a profit just because they're not for profit.
Yeah. Not-for-profit still make plenty of money, right? They just don't distribute to shareholders. Like that is the difference. And I think when people talk about we should have like a not-for-profit healthcare system, most of the research shows that not-for-profit hospitals and for-profit hospitals are very, very similar in their decision making. There are some differences. But the more competition there is in a market, the more they sort of act the same. Um, now, but there's much more charity care going on in not-for-profit. That's how they justify that not-for-profit status. But they're bringing in a lot of revenue, and so they, somebody has to pay for this. And so part of it is these tax subsidies, they're paying
Mhm.
for it. Another part, right, they're going to have a cost structure and they're going to do negotiations with their insurers. And so part of it probably is passed on to those insurers. It's hard to see exactly, it's not like, oh, Kelly came in, he had this debt that he didn't pay. I'm going to charge this to Steve, right? It's not
Mhm.
quite so clear. But again, the money has to come from somewhere. There's still a cost of that treatment. Somebody's going to pay for it. And so the idea that if we just get government out, I mean, the alternative is people just don't get care, right? That is the only alternative. It is not, oh, okay, we're going to get rid of these government subsidies and it'll be okay because the hospitals are making plenty of money. The hospitals in general are not making plenty of money. Um, I'm not saying that they're all on the verge of closing. Now, you talk about rural hospitals, that's a little different. But the money has to come from somewhere. Now, I just want to bring in real quickly. I see all these things talking about medical inflation. And inflation and the cost of care is really hard to compare. The reason is if the way when we think about the consumer price index, right? CPI is how we measure inflation. And if let's look at eggs and milk, right? Very core part of inflation, eggs and milk. If you bought a dozen eggs and a gallon of milk in 1980, the year I was born, 1980, and today, those eggs are largely the same. I don't know, maybe we've given a little more steroids to chickens or something, but in general, the eggs are the same and the milk is the same. And so you can say if eggs and milk cost $1 then and $10 now, right, it's 10 times as expensive. Medical is not the same. If you went to the hospital for a heart attack in 1980, your chances of surviving were I'm making up numbers here. I don't know what it is off the top of my
Mhm.
head, but let's say your chances of surviving a heart attack in 1980 were 50%. And if you go to the hospital today, your chances of surviving are, again, making this up, 85%. Well, yes, you're paying more money for the heart attack. And that's how, when you see these sort of stats, they usually look, okay, well, what was the cost of a heart attack in 1980 and what was the cost of a heart attack now? But they're omitting the fact that you're getting more value for that money, right? I'm more likely to survive. And there's a great paper. One came out in the late 80s by David Cutler and I can't remember who else is on the paper, maybe John Gruber, a couple of the architects of the ACA, that showed, right, even in the 80s, over a few years, people survived longer,
Mhm.
right, after having a heart attack. And even though the actual like sticker price was going up, even if you valued like a life year at, say $25,000 in those dollars for life, the actual like price per a life year was down, right? The paper's called "Are Medical
Ah.
Prices Declining?" And there's a new paper that came out in the last couple of years that kind of does the same for more than just heart attacks. They look at a variety of things and they find the same general findings that if you use some basic quality adjusted life year metrics, the actual money we're paying for an additional year of life has gone down, not up. Um, but the actual
So is
price we're
that like
paying,
applied to GDP and stuff too? Is it like
uh, it does to some extent. It's a little harder, right? So you can let's talk about the price of housing, right? Housing prices have gone up. We know housing prices have gone up. Also, the sizes of houses have gone up.
Mhm.
Right? And so if you look at the price per square foot of a house, it's not nearly up as much as the price of a house.
Mm.
You know, that doesn't necessarily make it easier for the 23-year-old that's trying to buy their first home, right? Because
Yeah.
they don't necessarily have the options for the smaller homes that existed then. And so it's again, like my health insurance premium is $27,000. That's great that having it really like has a lot of value. But if I don't have $27,000, how does that help me?
Mhm.
Right. Which is why this is a really complicated problem in that, yes, we're getting more value and you can't just compare it to inflation on goods that don't change. At the same point, we've got to figure out Like, how are we paying for this money? The US is a rich country. That doesn't mean all the individuals in it are rich, but as a country, GDP wise, we are a rich country. And so we've got to think about what is the government's role and how much should we be subsidizing and how much do we distort markets when we do subsidize, right? These are key policy discussions that we should be able to have in a bipartisan manner. Unfortunately, one of our major parties has decided that all taxes are bad and government shouldn't do anything. Um, and I don't like to sort of paint with that broad brush, but going back to Grover Norquist and the Club for Growth, the predominant Republican talking point is that taxes are theft, right? We shouldn't tax anything. That is a huge error. We need taxes. That doesn't mean we can't be a fiscal conservative. I'm a fiscal conservative. There are two sides to a ledger. There are revenues and there are outlays. Right? You need those two things to match up.
Yeah, people don't generally try to balance their budget by asking for a pay cut.
Exactly, right? We've got to collect more money. Again, U.S. is a rich country. We can collect more money. We need to do it in a smart manner. We need to do it in a progressive manner that says those who make more money pay more money. It's not, yes, and any tax economist will tell you, as you raise marginal interest rates, you are going to have some effect on employment, right? And investments. So that doesn't mean that you say, okay, well, if you make more than $400,000, you should pay whatever 90% marginal tax rates. Like, I'm not arguing that at all, and I hope nobody takes me out of context, right?
Yeah.
Right? But it does mean that if you're making $1 billion, you probably need to pay more than somebody who's making $400,000 or $200,000.
People like Elon Musk, laying off people after he's making, after he's worth $500 billion. It's like, you can't go, oh, if only Elon Musk had more money, he could hire more people.
It's a silly argument that some people like to make, right? Yes, that money is largely invested and does help. I'm not saying that there's no value to the money that he has. He's not sitting on cash. At the same point, there are things that the government needs to do. And right. So we need to make sure that people have, food. We need to make sure people have clean air. We need to audit, right? So even let's look in Medicare, Medicaid, we need to run audits. Let's talk about Doge. Well, Doge was not well run, right? A bunch of 20-year-olds who don't know what they're looking at, or 22-year-olds, whatever they were, going through government systems is not the way you do that. Maybe you need to enhance funding for the Government Accountability Office, the GAO. Nobody that I know of is arguing that there's not waste in government. But all those things cost money. And so the government has got to increase its revenue in order to cover these things. That doesn't mean that there's no room for costs for cutting costs. There are certainly government programs that could be reduced, but cutting SNAP is not going to make a dent in our budget, right? But it will, for many people, really affect their health and their livelihood, right? Not to mention the fact, let's talk about free school lunch, right? Kids don't learn well when they're hungry. And so the cost of school lunch is pretty low compared to the cost of other programs in this country. And yet we're arguing around these silly margins, because we want to just reduce $1 here and $1 there.
So I was thinking what you were talking about before with the heart attack and the life afterward.
Yeah.
With the school lunches and the better fed kids that do better in school, when they become adults, does that have that kind of same ripple effect to where they're more likely to go to college and invent things and produce things for the economy and all of that?
Yes. 1000% yes. Right? These are investments. We are investing in people. We are investing in our future. When an entrepreneur wants to start a business and they put down their down payment on their store or the IT system or whatever it is, we don't think about that as waste, right? We think about it as an investment that's going to, create a return. We need to be thinking about these programs as an investment. We're investing in people and they are going to create a return. They're going to increase our tax base. They're going to, increase the quality of life. Let's take, after World War II, when we made sure that energy, right, electricity and clean water pipes, right, or I should say running water, and the highway systems were all built. That was not government waste. It was huge government outlays.
Mm-hmm.
These were really expensive. Yet look at our economy today.
Yeah.
Economy doesn't blossom in the 50s and 60s if we weren't making those investments. Let's
The
look at
interstates, I
NIH.
think, probably helped the economy just a little bit. Like,
Yeah, just a little bit, right? The fact that we can get any product anywhere in this country is a huge, huge boon to our economy, right? The Amazons of the world don't exist if we don't have that.
mhm,
You
right.
know, you can look at NIH, right? We put billions into medical research, and look at the increase that we've made in life expectancy. And again, like, people like to point to the fact that the US spends more on healthcare and gets worse outcomes. I'm going to tell you something. If you have health insurance, that's not true. The easiest way, it's very hard to do cross country comparisons. But if you just look at 50th percentile, right? So people who make the median salary in a country and above, the US has better outcomes than any other country.
Mm,
The problem is that we have a bunch of uninsured who don't have good health care. The problem is we have people that don't have nutrition, right? Because they can't afford groceries or they live in nutrition deserts. Poor people do not have good health care in this country. Even right, if you just cut out trauma, we're much closer to the general distribution. We're still trailing, but if you just cut out trauma deaths, we are much closer to other countries. We have way more trauma deaths, car accidents, you know, predominantly car accidents, also gunshot wounds, in this country than in other countries, and that brings down our life expectancy. You cut those out, and we're closer to the distribution. Um, we gain something like 2.5 years of life expectancy if you cut those out. Other countries gain about a year, and so it just sort of closes the margin. But if you
why car accidents? That seems
what's that?
why car accidents? Do you know why we have
I would
higher?
guess because we drive more. That would be my guess. I don't know, but I mean, the U.S. we're much more spread out than most other countries, right? Much less
Mm.
walkable.
That might, because I've driven in Italy, man, and those people are insane.
Oh yeah. No, I mean, I've been across. Yeah, you're right. In other countries, they sometimes are more dangerous in certain areas. And I don't know what they are on like accidents per capita or per mile driven. I mean, somebody would have to do the analysis on that. The fact is, Americans drive almost everywhere. We have very limited public transportation infrastructure in this country.
Mhm.
That's a whole nother argument with whether we should or shouldn't, because we are more spread out than most other countries. Um, I'm a big fan of public transit, but I also understand that like it's not as clear a cost benefit analysis.
Yeah.
But because we have more of these traumas, uh, it brings down our life expectancy. But more importantly than that is the fact that lots of people can't afford care. That is what is killing our life expectancy. Once you get into the health system, we have the best health system in the world. We also have the most expensive health system, right? Those two things go hand in hand. We have lots of fixed costs. We have lots of technology. We're doing lots of investments in research and development. All those things cost money. Do they cost more than we have? Absolutely not. They cost more than an individual has. They don't
Mhm.
cost more than we as a country have. But we have to raise the funds, which requires a tax base. And so, you know, if you're, you know, a multimillionaire, you probably need to pay a little bit more in taxes. You know, I think that's just, unfortunately, you know, the money has to come from somewhere. But also, right, this has the potential to lower our costs in the long run. We can put the investments into primary care. By the way, we could change policy so that there's more incentive to invest in preventing illness. Right now, there's very little incentive to invest in preventing illness. There's a lot of incentive to invest in how to treat illness, right?
Mhm.
From a pharmaceutical standpoint, from a medical innovation standpoint, it's very hard to see the cost benefit to prevent cancer. Given the way our monopoly system, or I'm sorry, our patent system works, which is a legal monopoly. Uh, there's other ways. Bernie Sanders, and I'm not generally a supporter of Bernie's plans. He's much further left than I am. Uh, but he had an idea or at least sponsored the legislation to basically, rather than have a patent system, have a prize system, right? You develop the next drug, right, that cures cancer. We figure out the value of it, and you get a check from the government for it.
Mm.
Versus you get this monopoly that doesn't last very long, and you can charge really high prices for a short period of time, but you're going to have a limited market and a limited time period. Versus, oh, here's the benefit to society. Let me write you a check.
Did you
And
know,
that's
just as a trivia, that's
Mhm.
how we got canned foods, was a prize system.
I did not
Napoleon
know
offered
that.
a prize for whoever could figure out a way to can meat or
Mhm.
something like that, or to
Yeah.
preserve meat. And somebody figured out canning, and that's how we got pressure cookers and all of that kind of stuff. But yeah.
Yeah. Yeah. I mean, my bottom line point, and that's really interesting, but my bottom line point is there's a lot of things we can do to make health system more efficient, less expensive at the point of purchase. Again, the cost is the cost. It's very unlikely that the cost of care is going to go down as we innovate more. But there are things we can do to make it less at the cost of purchase. But we're not doing that right now. Right now, we're arguing about whether poor people deserve to have health care.
Yeah.
It,
It's weird how we managed to make everything the poor's responsibility and not like the people who actually have the
Mhm.
money's responsibility.
Yeah. Yeah. It's really we're in a politically we're in a bad spot right now
So
where
here's a segue into something else you wanted to talk about. There are a lot of people like um we talked about the rural hospitals and how there's a higher how those are failing, especially in Texas.
oh yeah.
And it's interesting to me that a lot of the same people that live in those areas where those hospitals are going to be closing down are actually voting for the policies that are going to cause those things to shut down. Um, like, can you and I know you wanted to talk about the Medicaid cuts and how actually those are probably an even bigger issue than the ACA supplements, and how this $50 billion rural hospital fund is nowhere near enough to offset all that's going to be lost from the Medicaid cuts. Do you want to talk about
Sure.
all
Let me yeah, it's a lot. Let me start with the first comment about rural hospital closures and people voting against their interests. And again, I'm gonna go a little bit against my party right now because I think we've made some major mistakes. And when I say against my party, I think Democrats largely have people's best interests in mind. I think sometimes the way in which we have done this has not been well executed. So rural hospitals are closing. The thing about hospitals, as technology has increased and things become more expensive, you have to have a certain number of customers in order to support that. So just think about a store, right? If you
that?
go to a mom and pop small convenience store or you go to a big box store, you a small mom and pop store has to charge more because they have fewer customers to share, say, the rent, right? Say they're paying $1,000 a month in rent. If they have 10 customers, then each one needs to pay $100, right? If they have 1,000 customers, each one needs to pay $1. Now take that to a hospital. If they buy an MRI machine, they have fewer customers to distribute the cost of the MRI machine over. And so it's really hard for rural hospitals to survive in the current environment simply because they're rural. They have, there are fewer people there. And so people aren't just going to come in, and it's going to be harder from a cost structure standpoint to keep those hospitals open. That's just basic economics, right?
Mm.
That is the problem, and that is nobody's fault. That is just the problem set that we are facing. There are different ways that we can address that problem. One is through government subsidies, right? So government can help offset the cost of the fixed prices. We can make sure that people who do live around there are all insured. We can change how much those insurers pay. All of those things are done in some way, shape, or form. I think we've overcomplicated it, but they're all done in some way, shape, or form. People voting against their interests, I think, are largely because they're only hearing one voice. We've been talking for an hour and we have brushed the surface of these issues.
Mm-hmm.
Are you expecting somebody who is working full time, let's say on a farm or a ranch, to spend the time listening and adjudicating these issues before they go vote. I don't even think that it's really theoretically possible, even if they wanted to learn all of these things. And it's not that these aren't smart people.
Yeah.
I'm in no way disparaging that. They're just busy, and it's really hard and complicated.
And I've said, I actually, this is a running theme on my podcast, is that you have people that work hard. They get up, they go to they go to work, they drive through traffic, they get home, they're exhausted, they have to take their kids to soccer practice or whatever. They have to, then they eat. By the time their day is over, it's 8 o'clock at night, and all they want to do is sit down and watch TV. And that's why you have stupid shows like the Chicago, like those Chicago, they just require no brain power to watch. They're very passive, or they want to watch stuff that, like angertainment, like Fox News, that they can just turn off their brain and it just absorb the energy of the show. And they don't want to sit there and think and look through complicated scenarios of healthcare insurance. They want to just be told what to do, and that it's that person's fault, and you can be angry and then go to bed.
Yeah, and if you don't have a graduate degree in economics, this stuff's pretty hard, right? Like it's not clear cut. Like go back to like how we measure inflation. It's just not something that you think about if you see a graph that says here's medical inflation and here's regular inflation, right? It's an oversimplification, but if you haven't been trained to think about it and understand how inflation is calculated, you don't even know the right questions to ask.
Yeah. Well, I would say there's 3 stages to learning, and the first stage is I don't know anything. The second stage is I know everything, and the third stage is I don't know anything. And it's like once you get to the second stage of I don't know anything, you actually know something.
Yeah. But here's where I think that the Democratic Party has failed. We, for strategic reasons, have decided that the urban area is our base, and we have not been out in rural areas as much talking to people. And you can go back to even the Hillary Clinton strategy where we lost the Rust Belt. Right? People are suffering. We have to be out there to listen and help people. And yet we've said, you know what, rural areas are our base. We're going to go out there and we're going to run up margins, and we'll lose the rural areas. But if we run up enough margins in urban areas, we'll win. I think that's a mistake. I think we have to get out and talk to people, because what people are hearing are Republicans coming out and saying, you matter. And again, their policies aren't helping them. Their policies are awful, but they're out there talking to them, or they're watching Fox News, hearing them say it's Democrats. Democrats hate you. And we're not even out there to dispute it. And so the only way we're going to get people to vote for us and for, our policies, which are going to help them, are to be out there saying, I care about you too, right? That Fox News is wrong. And we can argue about Fox News or OAN or any of these and some of the challenges that they face, but somebody's got to be out there to argue with them. Somebody's got to be out there to say that, let me tell you why I care. I know you hear on the news that Democrats hate America. I'm a veteran. I served 21 years in the military. I love you, right? I may disagree with you, but I love you, and I'm going to do what I can to help you. And oh, by the way, let me listen to your concerns and actually try to do something to help those specific concerns when I am elected in office. We have got to get back to being the party of the people, all people, not just urban people. We've got to get off our soapbox. And I think we're doing a pretty good job with this right now, but we've got to go on, like Buttigieg, go on Fox News and actually debate it. We've got to, get rid of any kind of purity tests and say, you know what, we can disagree on whatever, like transgender sports policies, where I think there's room for debate about what is appropriate and what isn't appropriate. And not say, you know what, you hate people if you don't agree with me. We've gone way too far in one direction, in the name of inclusion, which I am a big fan of, right? I am what I call a social libertarian. I think the government should stay out of your business, and you should be able to do right. Discrimination should be illegal. And beyond that, you should be able to do whatever you want with your life, as long as it doesn't trample on somebody else's rights. The challenge comes when it's not clear whether it does or doesn't impede somebody else's rights. And that's where, we have to have honest debate, But instead, we've sort of gone to our corner. The Republicans, who I'm not talking the ones who were sort of not hateful have been voted out of office. And so the ones in office now are just sort of going to their corner, and using it as red meat to go to people and say, right, and just try to go hateful policies and say it's because, Democrats care more about this than the food on your table, which again could not be further from the truth.
Yeah.
But I think we have got to go out there and let them know that, what, we can walk and chew gum at the same time. We can worry about inclusion, and we can also worry about the cost of groceries.
Yeah. Like if we're going to talk about inclusion, let's include everybody, including the rural farmers and the small town people.
Yep, exactly. Right. And so I think we have a lot of trust to regain, and we've got to tell them the truth so that they see through the lies they're being told through MAGA.
So, like I noticed a lot of these policies more than even in the past. Like the mass deportations are killing farmers, the small farmers. The large farmers not so much, because the large farmers can afford the H-1B visas or H-2B visas. Is it H-2B? Anyway, they can afford the visas to have ag workers come over. Small farmers can't. It costs an extra $7,000 per person per season for an ag visa. And small farmers just don't have that money. The Medicaid cuts that are going to destroy the rural hospitals. And one thing we've talked about before is if your rural hospital closes, if your nearest hospital closes, it doesn't matter how good your insurance is. If you have a heart attack and it's an hour drive instead of a 15-minute drive to the nearest hospital, that could be a matter of life and death, even if you have Cadillac insurance. And so these are policies that are really hurting the farmers. And when you hurt the farmers, you also hurt those rural communities that they live in. You look at the SNAP benefits. You're 24% more likely. You're 24% more likely to be on SNAP benefits if you live in a rural area than if you live in a big, Democrat-run city. Like there's policies that are really hurting Republicans, or Republicans are hurting their own voters. And I feel like if we need to go after those votes, and not by condescending to them, but by reaching out to them and offering a hand.
That's exactly it, right? We have to do town halls. We have to go out to rural areas and say, what matters to you, right? What can I do to earn your vote?
Mm-hmm.
And it's earning votes. It's talking about policies that will help people. We could talk about immigration for another hour and some of the issues around that. But at the end of the day, all of these policies that the Republicans, again, I want to differentiate sort of the people that were more moderate that have been voted out of office, because right now they're being primaried from the right over and over again.
Mm-hmm.
But the current MAGA Republicans are doing things in the best interest of their donors, and they're able to sort of breathe a lie to their constituents. Now, there's a reason that they're not holding town halls. It doesn't stand up to scrutiny.
Oh, they get beat down.
Yeah, it doesn't stand up to scrutiny. But right now they're the voice. They're the only voice coming out there, and what they're telling you is, hey, you love America, Democrats hate America. Again, couldn't be further from the truth. But it's what they're telling people. And so we have got to get out there and say, okay, you're more likely to be on SNAP benefits. Well, how do we SNAP is not the overall solution, right? People shouldn't need SNAP.
Yeah. The people are getting SNAP benefits even though they're working full time, because we have a system that rewards corporations for not paying people enough of a wage to live off of.
Yeah. I mean, and there's different solutions to that. I think you and I may have talked off air about this, but I'm a much bigger fan of what they call a reverse income tax than I am of raising the minimum wage. So if you raise the minimum wage, those who are making minimum wage make more, but they're certainly it's going to distort sort of investments in technology that will replace those workers, and honestly, it really doesn't fully solve the problem.
So explain
Versus,
reverse minimum wage or reverse income tax, because I had never heard that before, and
yeah.
it's different than like what universal
So
guaranteed income.
it's not exactly universal basic income or universal I can't remember the other term. There's different terms for that. What those are hey, everybody in the country is going to get whatever $40,000 a year, whatever it is, right? Completely unfeasible economically. I mean, like just from a cash basis, like it's just not feasible. I would, I wish it was. I was a proponent for a while until sort of the analysis just proved to me, and there's been enough tests of it to show that it's just not economically feasible. A reverse income tax is in the same sort of mindset. Let's say I'm working 40 hours a week and I file my taxes. Right now, there's what we have earned income tax credit, which says if you didn't earn enough, but you're working, you get a small amount back. That is a version of a reverse income tax, right? The idea is that if you're working and you're not making enough money, rather than paying additional taxes to the government writes you a check. So you get a tax rebate that's actually more than what you paid in taxes. That is, the EITC was a great start to that, but it's simply not enough.
This would be like on a monthly basis, or
yeah, I mean, you could do it either way. You could do it on a monthly basis. You could do it once a year. I think a monthly basis is better versus giving people a lump sum at once a year. And so, but again, like you file your taxes for the previous year. Let's say I worked 40 hours a week, making $8 an hour or something, right? And so whatever that comes out to, $320 a week times 52 weeks a year, simply not enough. And so we could say, okay, you know what? Everybody who works 40 hours should have the equivalent of 125% or 150% of the federal poverty, or whatever we want to set it at. And so then you get a check back. And again, we could distribute this monthly, just like we did with the child tax credit for a little bit during COVID, and say, okay, you're going to get an extra $400 a month based on what you would have made were you making a living wage, however we define a living wage. And you fund this through taxing. You could raise the corporate income tax rate, you could raise marginal tax rates. There's different, tax sort of systems that could do this. But what you do is you don't now, because you're raising the rates, there's the incentive isn't necessarily to replace your lowest wage workers with AI. You do have to worry that, okay, how do US tax rates compare with other countries' tax? Like, again, it's not that there's no danger in this. Any tax is going to have some effect.
mm-hmm.
But in general, I think it's going to have less of an effect. And it's going to have less effect on people than saying, okay, well, everybody has to pay $15 minimum wage.
And right now, we're probably erring too much on the side of worrying about taxing the wealthy, so that when you've got 40 million people that can't even pay for food, there's an issue. Like, we've overswung the pendulum.
Yeah, exactly. Right. We want businesses. Largely, we want small businesses. Right.
Mm-hmm.
Not that there's anything wrong with, I mean, look, big businesses are small businesses. There's nothing wrong with having big businesses. There is a problem with too much market concentration. And so this is why we have things like the FTC, the Federal Trade Commission, and we have antitrust laws to make sure that we're maintaining competition. If you pass something like a reverse income tax, then you're likely to get wages set based on as long as you have competition, they're going to be set based on competition. And in the cases where it's not, you're going to force those companies to pay more in taxes in order to cover those people. So that's, it's a complicated policy. There's more to it, but that's the general sort of gist, to say, look, you're working or you're disabled. Again, all these things are verifiable. And okay, well, if you're disabled, you should be getting Social Security disability. All these things tie in so that nobody has to go without food. And now you can replace things like SNAP benefits, because if people choose not to spend their money on food, that's their choice.
Mm-hmm.
But they've now been given the subsidy or the cash in order to be able to feed their families.
So if you subsidize things like healthcare for the poor and do the reverse income tax, like all of those things, you're building up the base. Is this like what's the, a rising tide raises all boats?
Yeah, absolutely.
Does it end up having a downstream effect where it actually helps the people that have more money as well as the people that have less money? Does it just grow the GDP overall?
I mean, I'll just throw a question at you, right? If you're a business, would you rather have fewer consumers or more consumers?
Yeah, exactly. More.
Right?
Yeah.
Like, if you give people money to spend, right? This is one of the reasons. So there's an old adage, economics, called the dismal discipline, right? People hated economists. Do you know why? Just go back to like the mid 19th century, people hated economists.
Because they knew everything?
No, none of us know everything. They found that slavery was not economically beneficial.
There you go. Okay.
Right? So economists came out against slavery in the mid 19th century because they found that if you pay workers, that increases demand for products, right? Increases economic output. Everybody ends up better off. And, whatever, slave owners in the mid 19th century didn't want to hear that. And so, it's been shown over time, if, as people have more resources to spend, they spend that money, they go buy products, it increases the markets that are available, it increases entrepreneurship, it increases innovation. All of this is good for our economy.
So they're looking at, we've got to pay our slaves. The economists are like, you can increase your consumers by 50%.
Yep, exactly. Right. Now, again, some of these are at the macro basis. This isn't to say like that one business is going to do better. The business that's hiring people for under the table $4 an hour that now has to go pay whatever and higher tax. Like, maybe that business is gonna make less money. But overall, the economy itself is going to do better, which is going to help more people.
So, to get back to I'm just bringing it back to this because I know you'd wanted to talk about it. Why are the Medicaid cuts so concerning to you?
Yeah, so I'll start. Before I talk about the Medicaid cuts, my bigger concern is the states that have not expanded Medicaid.
Okay,
so there are 10 states.
Can you explain what I did? Like, I'd always heard it and I looked it up recently and learned about it. But can you explain what it means when they talk about, expansion states?
Sure. So when the ACA was passed, it was designed so that the Medicaid program, which was fairly limited prior to implementation of the ACA, would be expanded. And so that anybody who made less than about 138%, I believe, of the federal poverty level would be eligible for Medicaid. The ACA subsidies were designed so that anybody who was Medicaid eligible could not be on the exchange. They could be on, but they would not get a subsidy.
Because it was like the cutoff for Medicaid, like if you made this much money for Medicaid, then the cutoff for Medicaid was the bottom margin of ACA, right? Like
exactly, right? So let's even just say like 100% of the federal poverty level, right? Everybody below 100% of the federal poverty level, in theory, should be eligible for Medicaid. And then you could start getting a subsidy at 100% of the federal poverty level as of today. Anyway,
I think what it was 100% of the federal poverty level for Medicaid, and then 138%.
Yeah, that was the original law, but these things have been adjusted over time.
Yeah,
that was the original law. But let's say today, right? If you are living in a non-expansion state, so like Texas, and you make less than 100% of the federal poverty level, you are not necessarily going to be allowed to join Texas Medicaid. But from a federal standpoint, you are eligible for Medicaid. This is a very nuance, but what that means is that you're not eligible for an ACA subsidy. And so you've got this huge number of people that are working poor. These people are predominantly working, but they're working for very low wages. Because they're working, they're not disabled, right? They're not necessarily eligible for Medicaid, depending on the state's rules. Texas has a very, very restrictive Medicaid program. And so you've got these people that have to pay full out of pocket for their insurance, which is basically more than their income for a year.
So they make too much for Medicaid, but not enough for ACA.
Exactly.
Exactly. Actually, if they made more money, they could get health care for free.
Cheaper. Yep, exactly.
Like
exactly.
If you make the bottom tier, the ACA covers 100% of it.
Yeah, exactly. I mean, exactly. So they're in this like a donut hole. This coverage gap is what we call it. Where, and again, this came down because the law itself required every state to expand Medicaid. It was challenged in the Supreme Court, and in 2012, the Supreme Court ruled that that was an overreach by the federal government, and it was because the Medicaid is a state program, states could decide whether or not to enhance their Medicaid programs or expand.
And this is one of those things where it feels like deliberate sabotage by Republicans to try and undermine the ACA.
Absolutely. Now, I don't necessarily think that the Supreme Court was wrong from a legal standpoint. I'm not a lawyer, right? Don't play one on TV. But, I think the ruling was probably the correct ruling based on the letter of the law. But the only reason it was challenged in court was because the states didn't want to expand Medicaid, when there's really very, very little financial cost to the states. It's mostly borne by the federal government. And oh, by the way, regardless of whether you're an expansion state, so people who work in Texas are paying in to expanded Medicaid. They're just not receiving the benefits.
And it's like I think the federal government reimburses the states 90. I think it was 100%, right?
Yeah,
and now
it's 100% for a short time. Yeah, it's 90. Yeah, it's 90-10. And that's the BBB, the Trump's bill has reduced that, and that's part of the challenge, right? And now
50% now.
Yeah. I think it's 50%. I wouldn't swear to the exact number. But the idea here is it's going to be much, much harder for these states to fund Medicaid. Now, this was put in the future, right? He was trying to do it in a way where, you can't see until after the midterms. Nobody feels the true pain of it. And honestly, in a state like Texas, it's not going to have that much of an effect because we hadn't expanded Medicaid to begin with. And a lot of the law was exempted. So some of the other sort of deleterious effects of this big BB were exempted for states that had not expanded Medicaid. So expanding Medicaid is now much more costly for a state because now you're going into this law that's basically set to punish Medicaid expansion states. But sorry, my dogs are barking in the background. To the original question, not covering people with Medicaid means that you have more uninsured, which, going back to the whole rural hospital issue, means you have more people that are coming in that can't pay. So you have more uncompensated care or more charity care, more people that are just going to show up in the ED and have to be stabilized, and no additional money coming in. This $50 billion is it's a drop in the bucket. $50 billion is very little when you think about the number of hospitals in this country and the number of rural hospitals and how much that is per a hospital, given the cost of care.
I think I was reading it was like 50 billion versus like 1.5 trillion or something like that.
It's not even. It's sort of like, I don't know if you saw on social media, they were advertising that somebody had written a check for $130 million to pay the troops. The budget to pay the troops is like $16 billion a month. It's $130 million with 1.3 million troops is like $100 a troop, right? It will not cover people's rent. Beyond the illegality of it, it's just it's a joke. But people who don't know, right? You're just scrolling. You're like, oh wow, they're going to get paid, not knowing that this number is just a joke when it comes to the broad finances.
But he'll get rewarded later on by Donald Trump for some through some government contract or something.
Sure. I mean, if you in fact you believe it's true, which I'm very skeptical that's even a true statement, but not that he would ever lie.
No, of course, Donald Trump he's a truth teller. So that anyway, that just I think sometimes people don't realize too that like in a lot of these small towns and whatnot, the hospitals are the largest employers. So
absolutely,
when they shut down, you can like the whole town suffers, not just from not having the hospital, but like they lose their and they're also the biggest consumer a lot of the time.
Yeah, I mean, you have to understand, 20% of our economy right now is in healthcare, or close to 20%, right? Basically, one in every $5 that you spend goes in some way to healthcare, whether it's through
Wow.
like pharmaceuticals or hospitals, doctors, right? IT, like all of these different components that go into the healthcare system. Um, one in every $5 we spend. And so when you think about a small town, that hospital is very likely the biggest employer in that town. And they're buying supplies and they're buying, somebody has to clean the sheets of the beds, like all of these things that go into a hospital. So when you're closing these things down, you are destroying a small town. Not to mention, like in my district, in 2017, we had a hospital closed down. People, it was actually in the district next to me, but people who lived about 15 miles, or not, sorry, 15 minutes from it in my district on the edge now have to drive almost an hour to get to a hospital, the closest hospital. If
And
you're
that's
having
what
a
I
heart
was
attack,
talking about with
Mhm.
doesn't matter how good your insurance is if if
Yep.
you're having a heart attack, an hour is an hour. It doesn't matter what your insurance is.
No, no, it doesn't matter. And it's extremely dangerous. So there's not enough time in the world on this podcast to go through everything we need to do. And honestly, we need open and honest debate. We need at least two parties in this country that can discuss the issues. And, there is room for debate about the role of government. Should the government be spending more? Should it be spending less? What's the role of the private sector? What's the role of competition? All of these are open for debate. I have certain feelings. Republican colleagues maybe have different feelings. Even my Democrat colleagues might have different feelings, right? There's
Mhm.
people who think that we should have single payer or government run hospital. Like, again, there's room for debate. There's no clear answer. The problem right now is we don't have a partner that's willing to actually engage in honest debate to try and solve these problems.
Didn't
And
you see
so,
Mike Johnson wave around the little booklet that was this really well thought out plan, and then the next day you have I forget which one of them was like, oh, we only need like 4 to 6 months to like really come up with a plan, and it's like Donald Trump's been 2 weeks away from announcing his
yeah,
plan for a decade now. It's like what you're saying though is there's never anything offered. What are you gonna do? Like
yeah.
you know, like
Well,
extend the supplements for a year while you come up with an alternative at least. Like you don't
sure,
have to
yeah,
permanently extend them.
yeah,
Like just
exactly.
extend them one more year instead of just like making it a now or nothing type of situation.
That's exactly it, right? Even if you want to say, okay, you know what? Right now you can pay up to 8.5%. Let's make it 10%, right? Like, now, do I think that we should do that? No, but that's a compromise. Like that's the nature of our system is marginal change, small changes. The ACA was a great start. There's lots of room to improve. Take Medicare. I mentioned this earlier, right? Medicare passed. I think it was passed in 65, implemented in 67, if I have my years right. We passed Medicare Part D, your pharmaceutical benefits, in the George W. Bush administration. I think it was passed in '04 and implemented in 2006. 40 years later, where we're still making changes. We're still today, there's this CMS Center for Innovation, and we're changing payment models. Like all of these things take
It just
time.
made me realize Bush was 20 years ago, and now I feel
I
really,
know.
really old.
Yeah, yeah. I mean, there's tons of work to do. We're not going to do it all in one fell swoop. It's too complicated, and we're going to make mistakes. Like there's no way around it that we're going to have policies that work and policies that don't. We're not perfect. We can't see the future. Any analysis, all analyses are flawed. Some are useful, right? To paraphrase a George Box quote. Um, we need an honest partner. We need to debate, and we need to pass small incremental laws to make people's lives better, one step at a time.
Amen. I think that's really where we need to we just need to have
Mhm.
actual conversations, but you can't have a
Mhm.
conversation when one party refuses to converse.
That's exactly it.
And
That's exactly it.
um So I think that is a good finishing point, except for one thing. Say somebody is super inspired by all you've said and wants to contribute to your campaign. Where do they go? How do they do that?
Okay, so the easiest way is go to my website, www.schwabfortexas.com. Are we able to put a link up?
Yeah, we'll put the I'll put the link in the comments or in the
Okay.
description section.
Yeah. If you go to schwabfortexas.com, you can sign up to get updates on the campaign. There's a little donate button. You can click that. That will take you to my Act Blue link in order to put a donation. We can also put the link directly to the Act Blue. Even if you can give $5, I will tell you that every dollar matters. This is a campaign that is powered by people, right? Individual contributors. Unlike my competitor, who has $1 million check from Governor Abbott through Super PAC, and I have already 200 plus individual donors. He in the last election cycle had less than I have now a year out because he just got one check and didn't have to fundraise. But 1 million people giving $1 is the same as $1 million check. So please, if you can give a couple dollars, do so. Doesn't have to be a lot because all of these things add up over time. So
And you're in an R plus 30 district, is that right?
I'm in R plus 30. I think it is an achievable R. So R plus 30 scarce, right? How can you win in an R plus 30? And I will tell you, one, Democrats have not competed in this district. We've had someone on the ballot, and like the guy last time was a great guy, but he didn't have any money, right? And so I've already raised more than that at this point in time. And we haven't gone out and gone to the rural areas like I was talking about earlier. And I spent a lot of time going out and talking with people. And a lot of the conversations start with, I would never vote for a Democrat. And then as you talk with people, you get more, well, I'm really an independent. I vote on the person, not the party. People have been fed a trough of lies. And it's my job to get through them, to understand that these are not true statements. And so we'll see what happens. Words are cheap, but we have a plan for how to enhance Democratic turnout, but also convince the center right that this is, I'm the best person on the ballot. I'm a veteran. I'm an economist, right? I am not super far left. I am believing in taking care of people. So as I'm a Democrat because we have the same goals, the way I do it is much more on the center in that I believe in market mechanisms to the extent the market can work, understanding that sometimes market fail and we need government intervention. I believe in small government, but I also think that I would rather have government that's a little too big than a little too small, given the risks, right? We saw that in Kerrville here in Texas, where there were floods that killed children because we didn't have the right warning systems. I'd rather have a warning system when you don't need one than not have a warning system when you do need one. And so I think there's a lot of room to turn Republicans that are not sort of in the MAGA cult. And so I spent a lot of time talking with people, and that's really the goal, is just to get out. And that's a lot of what the money I'm raising goes to. It's outreach. It's getting out to people and saying, okay, here's who I am and what I stand for and why I will do better than the Republicans that you've been electing.
I feel like one thing that you're doing that is really helpful is listening. I know, like, I live in rural Texas myself, and like you've been here. I don't know. Exactly live in a booming metropolis or something, and so I know a lot of people that are like in these, like have a good friend that's a Christmas tree farmer, and they're small business Midwestern or mid Texas Republicans, and they like when you talk to them and you let them talk and you listen to them and you actually hear them, they feel respected instead of being called deplorables or something. Like they feel respected.
Yeah.
If they feel like you respect them, they will respect you. There's a turnabout there.
That's exactly it, right? People want to be heard. And if we're not listening, they're not going to vote for us. And, it goes back to, what our dad would tell me, right? Like one mouth, two ears, listen more than you talk.
Yeah.
Like, really basic.
And that's I think about that. And I've been married for 26 years, and I'll tell you, there is nothing better than there's no better way to have a good marriage than to not only listen, but to like show you're listening by like repeating things back, you know, and and showing you're listening, not just pretending to listen. Like there's a difference.
There is a difference. I always tell, so I teach communication in some of my classes. I don't as part of sort of business and how to be successful. And I was telling people, communication takes two. Just because I said something, if you didn't understand it, then I didn't communicate it. And if you
Yeah.
said something and I didn't understand it, then it's not communicated. We have to sort of reach back and make sure we're on the same page.
So Steve, thanks for coming on. I've learned a lot. I hope you know the audience has also learned a lot. And I always love it when I have a guest that makes me think about things. So even though, you know, like you're my brother and stuff, and I still learn stuff from you. And anyway, go to Schwab for Texas, and your Schwab for Texas on Blue Sky, and your Steve Schwab on Twitter. Is that right?
No, I'm Schwab for Texas on everything. So
Schwab for Texas.
on Blue Sky, it'll be schwabfortexas.com because they make you put in the domain on there. On everything else, it's just at Schwab for Texas. Schwab, in case you can't see it, SCA. What's that?
And Threads.
Yep, I'm on Threads. I'm on TikTok. I'm on Substack. If you name it, I'm on it. And it's Schwab, SCHWAB for Texas.
Cool. So thanks for coming on. We're going to end now.
Thanks.